Casey Conran, 621, cranial nerve exams 1 through 12. If you would, for me, cover one nostril and breathe in and breathe out. Cover the other nostril and breathe in and breathe out. Now if you'll close your eyes and cover one nostril and breathe in and breathe out. Now if you'll cover the other nostril, keeping your eyes closed, breathe in and breathe out. Can you identify the scent?
Cinnamon.
Was the intensity the same on both sides?
Yes.
Okay, so now I'm going to check your eyes with doing a fundoscope. I'll be looking for papilledema, AV nicking, cotton wool spots, bruising. If you're going to look just in that direction for me. I'm just scanning the back of the eye. Look in that direction for me. Okay. And now I'm going to check your field of vision. So if you'll look right here for me, tell me if I'm holding up a 1, a 5, or a 2. Okay? Cover up one eye for me. And looking right here.
1, 5, 5, 1, 1, 5,
Okay? If you'll change eyes, cover up this. Looking right here.
1, 5, 1, 1, 5, 1.
Okay? And now I'm going to check your direct and consensual. So I'm going to have you look straight ahead for me. I'm looking for both eyes to constrict when I shine the light in one eye. So if I was to shine the light in the right eye and both of them constricted, and then I shine the light in the left eye and neither one of them constricted, then that would be a cranial nerve 2 lesion. If I was to shine the light in the right eye and the right eye constricted and the left eye did not, and then I was to shine the light in the left eye and the right eye constricted and the left one did not, that would be a cranial nerve 3 lesion. So then I'll do pupillary fatigue, looking straight ahead for me again. And this time I'm looking for the pupil to constrict and hold on both sides, and an abnormal finding would be if the pupil either did not constrict at all, it did not constrict and hold, or it oscillated like hippus. So then if you'll just look straight ahead for me, I'm looking for ptosis. If you'll lightly close your eyes, I'm looking for blepharospasms. Now I'll do convergence and accommodation. So I'm going to have you look at my finger and follow my finger with your eyes. I'm just looking for the eyes to track together. Okay. And so now what I'd like for you to do is look at my finger and look at the wall, and look at my finger and look at the wall, and look at my finger and look at the wall. Okay, now I'll do the H in space. So just follow my finger with your eyes. Holding it 3 seconds at the end of each pass so that I can check for nystagmus. Okay, and then I'll check for sensory 5. So this is the tool I'm going to use. Let me show you it doesn't hurt. Okay. Was the intensity the same all the way through? Was the intensity the same all the way through? Was the intensity the same on both sides? Was the intensity the same all the way through? Was the intensity the same all the way through? Was the intensity the same on both sides? Was the intensity the same all the way through? Is the intensity the same all the way through? Was the intensity the same on both sides?
Yes.
Was the intensity the same from the top to the bottom?
Yes.
Do the same thing with the cotton ball. Is the intensity the same all the way through?
Mhm.
Is the intensity the same all the way through? Was the intensity the same on both sides?
Yes.
Is the intensity the same all the way through?
Mhm.
Is the intensity the same all the way through?
Mhm.
Is the intensity the same on both sides?
Yes.
Is the intensity the same all the way through? Was the intensity the same all the way through?
Mhm.
Was the intensity the same on both sides?
Yes.
Was the intensity the same from top to bottom?
Yes.
Okay. Now I'm going to have you clench your jaw for me. All right. Clench it again. Okay, now open your mouth and resist me. Okay. Now if you would close your eyes tight, raise your eyebrows, smile, puff up your cheeks. What's the funniest thing you heard today? All right, now I'm going to test your hearing, so close your eyes for me. Can you hear this?
Mhm.
Tell me when it disappears.
No.
Okay. Can you hear this?
Yes.
Tell me when it disappears.
No.
Okay. So now I'm going to do the Weber test. Can you hear this?
Yes.
Is it the same on both sides?
No.
Where is
Louder
it?
on that
It's
side.
louder on the right side. So now I'm going to do the Rena test. Can you hear that?
Yes.
Tell me when it stops.
No.
Can you hear this?
Yes.
Tell me when it stops.
No.
Okay. So if the sound lateralized to her right ear, so she had air conduction greater than bone conduction, so that would be a sensory neuro loss in the left ear. And then if it was a conduction loss, then bone conduction would be greater than air conduction. So now I'm going to have you stand up for me. Stand here, arms to your side, looking straight this way, and I want you to walk heel to toe. All right, now if you would, come back just a little bit. This time, same thing, but close your eyes, and I'll stand close to you so that you don't fall. Heel to toe. Okay, good. You can stop, and you can have a seat. And I am looking, just look straight ahead for me. I'm just looking for resting nystagmus. Okay, I'm gonna check panel number 12, so if you'll just open up your mouth, leave your tongue in your mouth. I'm looking for fasciculations and atrophy. Now if you'll stick your tongue out. Okay, and then if you would, I'm gonna press on your cheek, you push your tongue against my cheek on this side, now on this side. Okay, so for cranial nerve 12, if there's a lesion on the right side, then the tongue would come and protrude towards the right side because it's gonna go towards the side of the lesion. And then I will check for palate elevation. So if you would for me, I'm gonna have you open your mouth and repeat after me and say ah, okay? Say ah, 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 ah. Okay. Both sides of her soft palate raised evenly. If in the case of a lesion, a physiological lesion, the side with the lesion would either not raise at all or it would not raise as much. With an ablative lesion, the side with the lesion would not raise at all and the uvula would deviate towards the strong side. So now I'm going to do the gag reflex. Okay. And have you just open your mouth. I'm going to stick this Q-tip open wide for me. Stick your tongue out. Ah, 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 ah. Sorry, one more time. Ah, ah. Okay. Sorry about that. Now I'm going to have you resist me checking the SCM. So turn your head to the right, now to the left. And then now, if you'll raise your shoulders up, don't let me push them down. Okay. That concludes cranial nerves 1 through 12 exam.